Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bone grafts. Introduction. A bone graft transplants bone tissue. Once your body accepts the bone graft, it provides a framework for the growth of new, living bone. Bone grafts can repair and rebuild diseased bones. Grafts can also repair bone loss caused by some types of fractures or cancers. In some cases, a bone graft may be used to build bone across a joint and prevent the joint from moving again. This program explains bone grafts. It covers reasons for bone grafts and possible risks and complications. It also talks about what to expect before, during, and after the procedure. The bones. Your bones help you move, give you shape, and support your body. Muscles help our bones to move together. Bone is a living tissue. It is made up of osteoid tissue, cartilaginous tissue, fibrous tissue. Osteoid tissue is compact. It forms the hard outer layer of bone. A tough and flexible tissue called cartilage is found at each end of a bone. It acts as a cushion. Fibrous tissue is thread-like. It covers the outside of the bone. Many bones have a space in the middle. This space is called the medullary cavity. Bones are also made up of bone marrow. Bone marrow is a soft and spongy tissue. It is found in the medullary cavity, which is in the center of most bones. Some bone marrow contains cells that create red blood cells, white blood cells, and platelets. Two types of cells are found in the bone: osteoblasts and osteoclasts. The osteoblast cells create new bone, while the osteoclast cells break down old bone. This process is constantly happening in our bodies. During childhood, more new bone is formed than old bone is removed. After about age 20, the body may remove more old bone than form new bone. Reasons for bone graft. There are many reasons a bone graft may be done. One reason is to repair injured or broken bones that have not healed. Another reason a bone graft may be done is to repair bones that are weak due to bone loss. This can strengthen the bone. Bone grafts may also be used to fuse joints together. This prevents movement of those joints and provides stability. In many cases, bone grafts are used to fill in an empty space. Such spaces may have been created by a surgical procedure, deformity, disease, injury. Bone grafts may be done throughout the body. For example, bone grafts may be used to repair bones in the hips, knees, mouth, spine.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Alternative treatments to bone grafts depend on the condition being treated. Bone grafts are used to rebuild and repair damaged or diseased bones. Other treatments may be used instead of bone grafts to repair such bones. Bone loss may be treated with a healthy diet that includes calcium, vitamin D, and calcium supplements. Medicine. Treatment for damaged or diseased bones may also include physical therapy to build muscle strength, other types of surgery to strengthen bones and correct deformities. Surgery may involve placing plates, pins, or screws to keep a damaged or broken bone in place. A cast or splint may also be worn. Before the procedure. Before the procedure, your surgeon will decide which type of bone graft will be used. The different types of bone grafts are allograft, autograft. An allograft is when the transplanted bone or tissue comes from the body of a different person. Most allograft bone comes from donors who have died. Tissue banks screen these donors. They also disinfect and test the donated bone to make sure it is safe to use. An autograft is when the transplanted bone or tissue comes from another part of your own body. Autograft bone often comes from your ribs, hips, or a leg. Autograft bone is one of the safest to use due to the low risk of disease transmission. It also offers a better chance of acceptance and effectiveness in the transplant site. But an additional surgical site and incision are needed to remove the autograft bone. In some cases, a substitute bone material may be used. This substitute is created from man-made materials. In all these cases, the bone that is placed in the body acts as a platform for new bone to form. As the new bone forms, the graft itself is absorbed by the body. This is why there are no rejection problems for a bone graft. Talk to your surgeon before the procedure to find out what type of bone graft will be used. Ask about the risks and benefits of each type of bone graft. You may have tests such as blood tests done before the procedure. These tests help make sure you are healthy enough for surgery. Smoking prevents the normal healing process after surgery. If you smoke, talk to your healthcare provider about ways to quit. Arrange for a family member or friend to drive you home from the surgery facility. You will not be able to drive yourself. Ask your surgeon for more specific instructions as to what medicines you can take before your surgery. Also ask when you should stop eating or drinking before the surgery. Bone graft. A bone graft is done under general anesthesia. This means you will be asleep and will not remember the procedure. In total, the time of the procedure varies depending on where the bone graft is placed and whether other procedures are done at the same time. The time of the operation can range from half an hour to 4 to 5 hours, if not more. If you are using autograft bone, the surgeon will first make an incision in the skin to remove the graft. Autograft bone is usually taken from the ribs, hip, or leg. This incision will be closed with stitches once the graft is removed. To place a bone graft, the surgeon makes an incision into the skin over the affected bone or joint. Scar tissue or damaged tissue around the bone may be removed. The bone graft is then shaped to fit in the space where it is needed. It is then inserted. To make sure it stays in place, the graft may be secured with pins, plates, or screws. When the surgeon is finished, the incision is closed with stitches. Risks and complications. The risks of a bone graft include those related to anesthesia and those related to surgery in general. Anesthesia is safe, but like any medicine, it can have risks. Complications of general anesthesia may include chipped teeth, cut lips, headache, nausea or vomiting, reaction to the medicines, sore throat, urinary retention. Rarely, anesthesia may cause serious complications such as breathing problems, lung infections, stroke, heart attack, death. Your anesthesiologist will talk to you before your surgery. He or she will ask about any medicines you are currently taking and will explain the risks and complications of anesthesia in more detail. Surgery in general also comes with risks. Complications may include bleeding that happens during or after surgery, infection, scars. If your bone graft uses autograft bone, infection may happen at the donor site or at the transplanted site. Risks and complications also may be related to this specific type of surgery. Rare but possible bone graft complications may include disease from an allograft bone, failure of the bone graft. This is more common in people who smoke. Nerve injury, pain where the autograft bone was removed. Before your surgery, talk to your healthcare provider about the risks and possible complications of a bone graft. After the procedure. Depending on the surgery site, you may go home the same day as your surgery, stay in the hospital overnight, or stay there for a few days. Your healthcare provider will let you know when you are able to go home. After surgery, you may need to wear a cast, a corset, or a splint. This can help keep the bone graft in place until it is healed. You may have some pain after the surgery. At times, the area where the bone graft is harvested hurts more than the area where the bone is grafted. You will need to keep the surgical site clean and dry. You will be given instructions about bathing. Your healthcare provider may limit your activities and exercise for a while. This may be for as long as 6 months. Your healthcare provider can use an X-ray to check and see if the area is healed. The bone graft itself may take 3 or more months to heal completely.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bone graft transplants bone tissue. Once your body accepts the bone graft, it provides a framework for growth of new living bone. Bone grafts may be done throughout the body. For example, bone grafts may be used to repair bones in the hips, knees, mouth, spine. Bone grafts can repair and rebuild diseased bones. Grafts can also repair bone loss caused by some types of fractures or cancers. There are 2 main types of bone grafts. Allograft, when the bone comes from the body of a donor. Autograft, when the bone comes from another part of your body. Like any surgery, a bone graft has some risks and possible complications. Talk to your healthcare provider about the risks and benefits of a bone graft before having the surgery. After surgery, the bone graft itself may take 3 or more months to heal completely. In the meantime, your healthcare provider may limit your activities and exercise. Make sure to understand your limits and follow your healthcare provider's instructions. Thank you for using Explain.